I'm Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney, and welcome to this video on stop pulling out your eyelashes. Yes, some people will pull out their eyelashes, believe it or not, and they'll think it's normal. They'll be told they've got abnormal lashes and they'll have it pulled out. They'll do it themselves in a mirror, get a mirror. Their friend might do it, or they'll go to an optometrist who'll do it. But quite often there's something else going on. The more you pull the lashes out, the less they'll grow back, and then you'll be seeking lashes, extensions, and all sorts of other crap. So stop doing it. So what can happen? Well, there can be other structural problems that can do this, and I'll show them to you. This is not an extensive review of why you can have lash problems. That's huge. But I'm going to cover three common ones. One is called entropion, where the eyelid rolls in against your eye. One happens after cosmetic surgery. People have cosmetic surgery of the lower lid or upper lid, and it rolls in. It's a real pain. And the other thing is something called epiblephron. Young kids can be affected by it and they get irritated eyes, but their lashes are rolling in. Here's a gentleman, looks all reasonable. He's an older gentleman clearly, and if you look on the left side of the screen, his lashes look a bit tatty, and when he looks down, bang, you can see it rolls in. He looks down, the image on the right side shows a normal positioning of the lid. The image on the left side shows the lid rolled in. These people are often told they've got misdirected lashes. They haven't. They've got a misdirected lid, and the lashes are rolling against your eye. Here's a lady who has it. It's quite severe. It looks painful, doesn't it? Very red eye, very swollen, and you can see I have pulled the lid out and rotated it out, and there's the lashes. The lashes aren't causing the problem. The lid is causing the problem, and the lashes are irritating the eye. So what do? Well, I fix it. And you can see here, I've everted, turned the eyelid back out so that when she moves up and down, it stops rolling in. That's called entropion surgery. Here's a gentleman who's had lashes rolling up and in after cosmetic surgery. And you can see the lashes in the outer part of the eyelid are pointing up. The lid is pulled down and he's got a red eye and he's not happy. He's had 3 attempts to fix it. So I'm not going to go through what I did, but when you do correct it, you raise the lid and turn it back out. There's a little bit of redness still there. It settles slowly over time, but that's what I do when I correct it. The next one is something called epiblephron. Young children often suffer this. They're born with it. There are genetic predispositions to it. And you can see here the inner and the central part of the lower lids. The lashes are pointing up. Look at the outer part of the lids, and they're pointing forward the way they should be. You can see the eyelid, the horizontal portion in the outer part of the eyelids, but not in the middle and central portion. Epiblephron. Epi means to the side, and blephron meaning lid, turning. Here's what it looks like under a microscope, and yes, it is uncomfortable. The lashes are rubbing up against your cornea. So here's what it looks like after correction. I've rotated it back out to restore the normal position. And further, what we want is we want the lashes to rotate forward so it looks normal, like a normal eyelid, like we've never operated on, but also when they look down, it doesn't roll the eyelid in, and that's what the bottom image shows. When they look down, it actually pulls the lashes away and doesn't roll the eyelid in and cause irritation. So when it comes to your lashes, don't sit there and pluck them out. Some people do it from allergies and nervous tweaks, and they'll pluck out all their lashes. Just stop. Stop playing with them. You could have a problem underneath, and it can be fixed. And I hope that all makes sense. I'm Dr Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney, and thanks for watching.